Today, I want to talk about a love of mine, a passion of mine, which is helping musicians keep their careers alive, their hands working, get out of pain, be able to perform, be able to play, be at the top of their game. I've had a reputation for years because I've researched this area for years and developed techniques that have worked for a long, long time in bringing musicians back to the best playing of their life, gotten rid of pain that was crippling them, sped up their ability to play with absolute speed and control, and just generally get things going as strong and as best as they've ever been. And this has to do with work that is to fix often wrists, hands, fingers, thumbs, things that are called carpal tunnel syndrome in the wrist itself, it may be named that, problems that come out of the elbow, into the forearm, above the wrist, problems in the shoulder, a lot of times coming out of the neck. You got bass players and guitar players and other instrumentalists who have straps and ways that the pressure is put on their neck that affects the nerves that go down into the arms and hands. All of those have been objects of my research in terms of being able to help musicians play the best they can and get out of the pain problems that no one's been able to fix. It can come from injury. You don't want to land on your bent back wrist if you're a skateboarder or a skater or whatever. You probably want to get yourself some wrist braces. Don't land on your bent back wrist. I don't even advise you to do push-ups on your bent back wrist. Get some push-up bars. Putting weight into the bent back wrist can give you a carpal tunnel, but more than 50% of all the musicians who come to me who have problems into the arms and hands, fingers and thumb, wrists and so forth, the problem actually started in their neck, in the lower and sometimes lower and upper neck both, or the whole neck itself. They didn't necessarily connect it, their doctors didn't. They look at a problem, the doctor says, well, if the problem seems to be in your wrist, must be in your wrist. No, that's not true. You may have a problem in your wrist now. You may have a problem in your finger or thumb now that I've got to fix. You may have a tennis elbow kind of problem in your radius connection to your elbow, or which can go down to your thumb and first two fingers. You may have problems affecting the shoulder coming out of the very lower neck, going into other parts out of this area known as the brachial plexus. That's the arm-shoulder switchboard. All of the nerves that serve everything here come out of the spinal cord and leave out of the lower neck. So we've got people with whiplash injuries. You've got people whose instruments are messing up their neck day to day. Their sitting position is bad on their drum throne. Different things are affecting this that we need to deal with. But in the end, most of these problems turn out to be nerve problems. Nerves are the things that give you pain and tell you it hurts. And you go, man, I can't play. I play for a short while and it hurts so darn much I can't continue. That is coming from nerves, and actually the problem is in the nerves. You say, well, you know, the lights are off in the ceiling here. Maybe I should change all the light bulbs. Well, maybe not. Maybe I should make sure that the switch is turned on at the wall, because that's where the power is coming from. Here it's wires, nerves are our wires. Maybe it's the circuit breaker out at the side of the house and I've got the one tripped to this room and that's the reason the lights are out. Changing the bulbs won't do me any good. Maybe even the whole neighborhood's down because there's a generator that blew, some transformer that blew, and I don't have power coming from there. Just exercising the light bulb, just trying to fix or change the light bulb, do surgery on the light bulb, take a knife and cut on the light bulb, spray paint over the problem like drugs do with spray paint on the light bulb. None of that is going to fix the problem. What you have to do is find the cause. Well, you go to a medical doctor and he tries to make himself and you feel better with a nice Latin sounding name, a nice medical sounding term. He might call it a carpal tunnel, or he tells you it's a tendonitis, or it's a bursitis, or it's a repetitive stress injury, or you've got a neuropathy, which means nerve problem. And you feel, oh, he must be very smart. He's got a nice big word for my problem. And then once he's got his big word, which is usually completely inaccurate, doesn't know really where the problems are coming from at all, most of these things, I end up having to fix 6, 7, 8 different issues to fix one hand problem. And every one of the 8 needs to be fixed. 5 out of 8 wouldn't do it, 1 out of 8 wouldn't do it, and no matter how many drugs you took, that couldn't do it. Why? Because you don't have a problem in your hands because you've got a painkiller deficiency. You don't have a problem in your hands because you didn't take enough Advil. And yet, if they give you anti-inflammatory drugs, pain-killing drugs, opiate drugs, maybe even these psychiatric drugs that are transformed into the highest level painkillers, and the best you get is what? Usually temporary cover-up. And it doesn't even do that most of the time fully. So you don't even get 100% temporary cover-up of the pain. You can't spray paint over the problem completely, even with the drugs. And what do you get as a bonus round? The side effects. Drugs are synthetic, chemical. They all have side effects. I can say that, and you don't usually get to say generalities, but drugs all have side effects. Most of them aren't good, and you're paying that price when you don't even fix the underlying problem. A principle in my work, and should be in your thinking, is find the real causes, and fix the causes. Don't just try to treat the symptom. So after the drugs, or now they say, well, you know, we need to do a carpal tunnel surgery. We'll go in and cut on your wrist and that will fix you. I was invited to speak a number of times each year at the Musicians Institute of Technology, a very reputable music school here in LA. And the reason is the founding guitar instructor there, Les, came to me with 4 failed carpal tunnel surgeries. They had cut on each of his wrists with a carpal tunnel surgery 2 times. 2 on the left, 2 on the right, 4 surgeries in all, no improvement. When he heard about me and came to me, we had all of his pain gone and he was playing perfectly in a matter of weeks. Did that excite him? Pretty much. Did he send me a lot of his students to fix? You bet he did, and his friends as well. If you can fix the cause of the problem in a non-invasive way, in a natural way, in a safe way, you're making sense. And what I've usually got to do is correct the relationship of joints to nerves. There's an important relationship of joints to nerves. We learned this early in chiropractic, that the joints of the neck, when they were pinching or interfering with nerves, could mess up the nerves to your lungs or to your heart or to your hand or to your thumb or wherever the nerve went, to your bladder, to your uterus, to your toes, to the back of your leg with your sciatic nerve. Pinched and interfered with nerves at the spine will interfere with nerves, and you want to fix that. Usually the best way to do it is precision chiropractic, finding out exactly which way it's wrong and doing exactly the right things to fix it, and then doing the things to let it heal. The same thing's true if you've damaged the joints of a wrist, given yourself something like a tennis elbow and moved one of the major functional bones in the elbow, micro-torn ligaments there, sprained or damaged into the shoulder. You don't even remember when you did it or how you did it, or maybe you do. Maybe you know what injuries you had. Maybe you remember it all started with a car accident. I had a patient come to me new this week who took a spill, fell in her kitchen, slammed her head in the fall into a doorknob, and for 2 years has had problems in her arms, hands, neck that no one's been able to fix. It's tormented her. She spent an uncounted thousands of dollars that she spent trying to get her life back and really gotten very little out of it. She's come to me. Our tests have shown what's wrong. I expect to have her fixed in no time. One of the greatest drummers, probably the greatest drummer living today, had to play a gig one night. He was in terrible pain. He came to me, asked me to help him out. We know each other. I've helped him before. One absolutely accurate, correct adjustment. He went out and played the gig pain-free. Absolutely great. That's very typical of the kind of results you can get when you can apply this level of in-depth research that we've been doing. This springboards out of muscle testing, the area called applied kinesiology, but we've gone much deeper now to where every little test of how the finger strengths, arm strengths, shoulder strengths in different positions are working will tell me exactly what I need to fix. And believe it or not, I can know what needs to be fixed in a person's arm, hand, finger, thumb, wrist, usually in less than 1.5 minutes of testing. With no invasive testing, I don't have to do what the medical doctors may do, stick needles in you and try to run electric currents through you and see where things are firing or not, which itself is still so inaccurate that you still don't even know what you need to fix or how the heck you're going to fix it. But they can do that and charge maybe thousands of dollars for the testing and sound wise again, but not be able to fix you. But when we use these techniques, we know exactly what to fix, we know exactly what to do. We can incorporate the use of very specific nutrition to fix the joints that need healing, the nerves that need balancing, and sometimes the glands that are stressed out that need to be strengthened so that the whole system can rapidly heal and get totally back to where you want it to be as a player. And that pretty much covers, as quickly as I can, this beautiful subject of bringing musicians back to the ability of being able to play pain-free with strength and control that they have lost.